This is Time Warner Cable's local edition. My name is Brad Pomerance. Our guest today is Laura Richardson. She's a member of the United States Congress, and I want to speak with you about MediCare. It's back in the news as a result of Paul Ryan's selection to be Mitt Romney's vice presidential candidate. Now, as I understand it, and correct me if I'm wrong, the Ryan plan, which I believe Mr. Romney has now adopted, would create vouchers for seniors to shop for private insurance. Could one not argue that creates more choice, and as a result, it's a net plus?
As long as that choice exists everywhere, and that the services that are provided within that choice is sufficient for what people need. I'll give you the example of education vouchers, or let's say, you have a voucher to go to the store. Maybe you go to the store, you need a suit, what happens if that voucher only pays for, smalls and mediums, but doesn't pay for a large? So what do you do?
And as I understand it, the voucher as pursuant to the Ryan plan would not track inflation.
That's correct.
So what you're describing is a risk with the voucher program as currently written.
Right, because the voucher system only allows you to be able to pay for that particular system that you can afford. Well, what happens, someone like yourself, you probably could pay the supplemental like maybe you do at a kid where kids go to school, where you could put in a little bit more to help out. What about the people who don't have a little bit more to pay for that other service? So then that means that some people would not necessarily receive all of the services that they need.
At the same time, what the Romney-Ryan ticket is saying is that under the Affordable Care Act, the Obama plan, the Obama healthcare reform, about $700 billion is slated to be cut in terms of spending through efficiencies, through improved quality, and they want to restore that funding.
That's robbing from Peter to pay Paul, and it's completely false. The Affordable Care Act, which I had an opportunity to vote on, what was intended by that was savings. Things like going into medical records, going into having full access of those records, and so you don't have duplication of tests and things like that, which pays a high cost of increases of costs in Medicare. It also has to do with things like having Medicare reform, making sure that people are filling out the right forms, the people who should have it are getting it, that there's no fraud involved. So the cuts to Medicare were not to cut the services of Medicare, which is what the Ryan and Romney plan would do. Let's be real fair about it. Vouchers don't work. I don't support vouchers for education, and I certainly don't support them for health care. A voucher system is a way to be able to provide some with a less than adequate health care that would be allowed, and others who could pay a little bit more would have something better. Health care, everyone needs to be able to have a decent quality of life.
Are your voters saying that? Because look, the healthcare debate has become muddled, to say the least. I think it's fair to say since the U.S. Supreme Court upheld what we know as Obamacare, it seems as if the plan's gotten a little more popular, but still there's confusion. Do your voters see it the way you see it? Is the best way to ask?
That's an excellent question. In my district, I have a 37th Congressional District senior briefing. 1,250 seniors came. And what they're not confused about is now for the first time they have a preventative maintenance, preventative care appointment that they can have at no cost to them. That now their grandchildren can be on their children's insurance and be covered until the age of 26 because a lot of them can't find a job. Pre-existing conditions, if a person had diabetes or breast cancer or something like that and wasn't being covered, now that they are. So people are not confused. They're very clear on the fact that for the first time, the consumer is in the first spot instead of the insurance company. And that's what this debate is all about.
Her name is Laura Richardson. She's a member of the United States Congress. My name is Brad Pomerance. Thank you so much for watching Time Warner Cable's local edition.